Welcome back to Rural Health News, the segment of Rural Health Today where we fill you in on the latest in rural health headlines. We'll cover 3 headlines in today's episode: what's most urgent, a rural health damage report, and a success story to send us into the week. Most urgent in this week's news update is the recent ruling on 340B drug program. On May 15th, a federal judge ruled against pharmaceutical makers opposing the 340B drug pricing program rebate model. 340B will be an instrumental part in the future of efficient and affordable healthcare, and hospitals across this nation are celebrating the win. Though there is still much discussion occurring about this program, we can take time to celebrate the great news. In a statement following the court ruling, 340B Health President and CEO reported that 340B hospitals provide 77% of Medicaid hospital care and 67% of uncompensated care. She said without vital 340B savings, many hospitals will be forced to scale back or eliminate programs, leaving patients and communities without access to affordable care. We will provide updates on the status of 340B in the future episode. On to the damage report. This week, we're going to discuss the health funding cuts overview provided by KFF Health News. Now, these cuts are more and more concerning across the nation's healthcare organizations and especially in rural communities. While any cuts to care are most often very dangerous to patients and families, not every budget proposal is created equal in the toll it will take on the American healthcare system. The first cuts are to the National Institute of Health, referred to as NIH, the largest public funding of biomedical research in the world. The Trump administration has cut $2.3 billion of the NIH grant funding so far. Now, this includes funding for vaccine hesitancy, COVID-19, and training grants for health sciences professionals. We've reported previously of funding cuts to university science research, and so far, these cuts are still being blocked by the federal courts. If the administration manages to move forward with these cuts, many schools with limited financial resources will be unable to maintain any scientific research. Another area of funding cuts is public health. Some of the CDC's block grants are either being cut or threatened to be cut. Another area of funding cuts is public health. Some of the CDC's block grants are either being cut or threatened. One of the most concerning is the funding used to train the public health workforce. Since the start of the administration, thousands of public health workers, including researchers, doctors, and scientists, have all been laid off. While the state of tariffs is still unstable, the healthcare industry will experience negative impacts from tariffs on pharmaceutical materials and supplies. In addition, the slowdown on imports and product deliveries caused by other tariffs may cripple healthcare's supply chain across the entire industry. Lastly, and most concerningly, are the cuts to Medicaid. While many members of Congress and the administration still claim Medicaid beneficiaries will not suffer from the $880 billion cut that's included in the One Big Beautiful Bill, hospitals and associations across the nation remain on high alert as the funding cuts are passed through this reconciliation process. The focus of the cuts is on work requirements and provider tax, with some restrictions effective upon the bill's enactment and some targeted for later in the 10-year implementation timeline. The next step for cutting Medicaid funding is a Senate vote, expected to take place in June. Lift your voice, let your voice be heard, and oppose these cuts to our healthcare industry. Today's success story comes from Keck Medicine of USC and UCLA Health, where surgeons completed the world's first human bladder transplant on May 4th. The patient had previously had surgery to remove cancer from his bladder and 2 kidney removals due to the renal cancer. After 7 years of dialysis, he became the first bladder transplant patient. The procedure took 8 hours between the kidney and bladder transplants. Post-operation, both the kidney and the bladder were working properly, and the patient has been recovering very well. This groundbreaking surgery will change the future of urology, providing safer and longer-lasting options for patients with non-functioning or terminal bladders. Thank you to our sources for this episode: Fierce Healthcare, 340B Health, KFF Health News, Stat News, National Institute of Health, AP News, and Becker's Hospital Review.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.